Asking you all morning if you have any health questions, worries or ailments, and we always like to open our doors here in the studio for that with our tele-doctor. What do you call him?
Dr. Emeka?
No,
oh,
I know
that. It's segment. Telemedicine. Telemedicine. Sorry.
No,
what do you call
that sounds like, what do you call him? He's sitting here, Dr. Emeka
no, it's because that's the new thing, isn't it?
Yeah. So Isabel came up with this title, Telemedicine.
Well, yeah, it's the future, isn't it? They're saying if you can't see a GP, give them a call or you can FaceTime. And then it's like, we're actually doing telemedicine. Anyway, that tickles my fancy. Look, people have been sending in their questions. Actually, the first one that we got was from a lady called Rachel. It's actually about her periods, and I'm sorry if people are having their breakfast, but she said, it's been almost 2 years since I had my child. My period still hasn't returned. Is this normal? And this actually sparked a big discussion in the newsroom this morning. All of the girls, from all the producers and the girls in the gallery, leaping in to talk about it. So obviously resonated with lots of them. Lots of people saying that their periods have been affected by vaccines during the pandemic. So a couple of period questions for you.
Yeah, so I have heard, and especially I have seen people who come into A&E who've told me that their period's been affected by the vaccine. There's no specific link with any type of vaccine and periods at the moment, but like when you've given birth, obviously you know that periods are caused by hormones, and these are affected by not only birth, but after birth, breastfeeding as well, and contraception. So it is normal for people to have a change in their menstrual cycle or irregular periods postpartum. What it is normally, if you're not breastfeeding, you'll see your period within about 6 to 8 weeks after you've given birth. However, this can take longer, and when they do come back, they may be different. So they may be irregular, your cycle may change, they may be a little bit heavier and have blood clots, and this is normal within women. But if after 2 years you're not breastfeeding and you're not taking any contraception, you haven't seen your period, I would suggest to see your doctor just so they can run some tests to make sure your hormones are acting the way they should. OK,
so you'd be worried there could be some imbalance with the hormones?
There can be a number of different things that can go wrong postpartum. And as I said, it changes within women, and it depends on whether or not you have been breastfeeding or you've started any contraception.
Good advice, thank you.
Beer bellies. I'm asking for a friend.
Oh, are you sure?
And this is from Nick. Nick says, look, what can I do to stop my beer belly from growing? I've stopped drinking beer, but it hasn't gone away. Now, the thing is, this is just not a cosmetic thing. This is really dangerous because this is where all the bad fat gathers.
Yeah, central adiposity. So it's, especially here in the UK, we have a bit of an obesity problem. And like Rome wasn't built in a day, your beer belly won't go away in a day. So yes, you may stop drinking beer, but there are a number of different other things you have to do.
Do you have a beer belly?
I hope not. I do my crunches, so. But for me,
it's sarcastic. He is a specimen, isn't he? What a fitness specimen he is.
No, there's so many things that come into it. So it's not just the alcohol. We do know that alcohol, especially beer, has a lot of calories. But you also think of what you're eating in terms of your nutrition. Yes. Are you getting your 5 a day? How much are you eating? Your calorific deficit? And are you exercising?
Something that struck me. I remember reading one time that I'm a great drinker of fizzy drinks. Apparently, fizzy drinks go straight to your belly.
Well, there's a lot of sugar in fizzy drinks. Yeah. There's a lot of refined sugar in fizzy drinks, so it wouldn't surprise me. But then, like a lot of people know, different people gain weight in different places. So I know some people it goes straight to their face. Yeah. And they get them big cheeks, and some people straight to the belly.
Mine's all to the behind, and it's all made of cheese, my husband says, because I love my cheese. Listen, 5 a day, do you get your 5 a day, and how important is that? I mean, I get home from work sometimes and I feel guilty that I have, just eaten toast or carbs, and I'll just eat a carrot to make myself feel better.
Oh, no, it's really important to get your 5 a day. I make sure I get mine, so I start with 5 a day. So in the mornings, I genuinely have a piece of fruit, or add fruit to my breakfast cereal, and then make sure, like, if I feel like snacking during the day between meals, I'm generally having some fruit or some vegetables, and I incorporate it in my meals as well. So
practice what you preach.
I do practice what I preach. I'm about that.
A lot of women are embarrassed, well, obviously embarrassed, a lot of men are embarrassed as well by hair loss. And here's Jess, and she's saying her mum and her nan both began to lose their hair in their 30s. She's getting to that age, and she's very worried about it. So is this hereditary?
Well, unfortunately for Jess, yes, alopecia can be hereditary. We call that androgenic alopecia, basically, when an imbalance of hormones can cause you to lose your hair at a certain age. However, it's a bit of an oxymoron because although Jess is worried, worry also can lead to a bit of alopecia too. So the only thing I can really advise her is to, one, stay away from putting too many chemicals in the hair, because this is obviously going to speed up the process of hair loss. And try and avoid hair pulling type styles, like tight ponytails as well.
So what do you mean? What do you mean? So if you put hairspray to volumize or something, that could lead to
It depends what type of hairspray you're putting in and how often you put it in. And also heat treating for the hair as well has been known to cause alopecia too. So if she can avoid that, she can potentially limit or reduce the chance of her suffering from alopecia. However, with alopecia, a lot of the time the hair can grow back, and there are a number of different treatments we can give.
Yeah, and I should state, this happened to a friend of mine. She had really amazing sort of weaves put in, which a lot of people use when they've been through chemotherapy. So there are ways of hiding it if it is.
Yeah, there are. 100%, especially when I've seen a number of chemo patients. I actually worked on a chemo ward, and I actually got educated on a number of different things they do post-chemo for their hair loss. So, yeah.
Fantastic to have those options available.
Like the end of the tunnel.
We've got to leave it there. I'm so sorry.
Thanks, Doc. Thank you. Good seeing you.
Thank you. Thank you guys for having me.
Do you know, when I look at him, I often think he reminds me of me in so many ways. Fruit in the morning, first thing. Never out of the gym.
Practices what he preaches.
Yeah, look at him.
Of course, literally, I have a health book called Your Health in Your Hands, which kind of says all the kind of stuff to do for like a healthy lifestyle. So, and I did recipes and nutrition in the book. So if I didn't practice it...
Well, bring us your book, man. We need this book, and we need it now.
I need to look healthy if I want my patients to be healthy.
Yeah, this is true. Okay.
That's a very good point.